Hi everyone, welcome back. We're going to be talking about endometrial biopsy in this video. Your doctor said for some reason that you need an endometrial biopsy done. Why is that? What is the procedure like? I heard it's painful. We're going over everything in this video, so stay tuned. Again, my name is Eric Schmit. I'm a board certified OBGYN, minimally invasive gynecologic surgeon, 30 videos in 30 days. This is another video in our September fundraiser for raising money for gynecologic cancer research. If you have the ability to donate, we're only looking for small amounts, so please do so below. There is a link in the description. So what is an endometrial biopsy? An endometrial biopsy is a biopsy or sampling of tissue of the endometrial lining. The endometrial lining, again, is the inside lining of the uterus where the bleeding comes from. This layer builds and sheds throughout someone's menstrual cycle, and sometimes this can go awry, meaning that sometimes the endometrium can make little mistakes, leading to something like precancers or cancers. So 99% of the time when someone's being recommended they have an endometrial biopsy done, it's likely for the evaluation of precancers or cancers of the endometrial lining. The precancer we call hyperplasia. The cancer of the lining would be the endometrial cancer. We talked about in the previous video, and so you can check out that video there. More rarely, endometrial biopsies can be done for infertility reasons, but I don't do it for that reason. That would be the infertility doctors. And so likely if someone's getting recommended that they have an endometrial biopsy done, it's because they have a bleeding issue. And this bleeding issue is probably after someone's mid-30s, 40s, or they have a lot of risk factors for those precancers or cancers. Those risk factors would be things like PCOS or obesity, things that cause chronic anovulation, meaning the cycle of the menstrual cycle isn't allowing the endometrium to go through its normal building and shedding process, and so that's when the mistakes can happen. Also, if people have bleeding after menopause, that can be a big reason why we do these endometrial biopsies. Often we're doing these procedures also prior to other surgeries, like an endometrial ablation. If someone has a bleeding issue, they're in their 40s, and we want to evaluate make sure it's not a precancer or cancer, but also if we're going to be doing something like burning over that lining in an endometrial ablation, then we want to make sure there's no precancer or cancer hiding that could be buried by that ablation procedure. Also, we're also making sure that there's no precancers or cancers before something like a hysterectomy, and we talk about that in other videos too. But those are some of the main reasons why we might be doing this procedure. A big reason why I wanted to make this video is to answer the question, does it hurt? And the short answer is, for most people, yes. It is a procedure where when that pipette goes through the cervix and up into the uterus, there can be significant amount of pain and cramping. However, we're also going to talk about how to make it better so it doesn't hurt like that. But before we get into the different ways to make the pain during the procedure better, let's talk about the procedure itself. The endometrial biopsy procedure is often done in the office. Now, if someone is having any of these issues and they want a procedure done under anesthesia at the hospital, often we'd be doing like a DNC procedure and hysteroscopy procedure. Again, we talk about that in other videos, but that would be likely that if you needed endometrial sampling to rule things out that are abnormal, that would be the way you do it under anesthesia in the hospital. But for the most part, we do these in the office and hopefully are able to achieve a level of comfort that is acceptable. Number one, it's an exam just like a pap smear. We use a speculum to look inside the vagina to see the cervix, and then what we usually do is clean the cervix with iodine. As long as you don't have an allergy to this, we might use a different way to clean the cervix if you do, because we don't want to be pushing anything up into the cervix and uterus that could cause infection, because that is a sterile environment. But at this point in time, often we're offering one of the pain control options or an injection into the cervix with a local anesthetic to help with pain control. We'll talk about that more here in a second. And then the pipette, the endometrial biopsy pipette, which we have right here, is going to find its way through the cervix up into the uterus. And this is often when the big cramp is, but as something's passing through the upper cervix into the lower uterus, there should be a big cramp. It should only be about a 5, maybe 10-second procedure where we pull back on that little pipette, creates a little suction, and it gets some of that tissue out to sample. And it's really good at sampling the area to make sure that there is no precancer or cancer hiding out. Now, there are some situations where it can be harder to get that pipette in through the cervix. This can be situations like if someone's postmenopausal, 5-10 years after menopause, that lower level of estrogen causes that cervix, if the cervix looks like a donut, to be really tight, even almost scarred shut. And so getting that little pipette in can be sometimes difficult. Again, anesthesia and maybe some extra instruments, we can usually achieve this without an issue in the office and with the patient comfortable. The other scenario where it sometimes can make it more difficult is if the uterus has significant tilt or flex to it. Just finding that path, that's often why sometimes we might need to use a grasper on the cervix to help straighten out the path from the cervix to the uterus, so this can be done quickly and efficiently, so hopefully less pain, discomfort, and less time. And I know that last part, using one of the clamps that we have available, is cause of significant concern for a lot of people. But if someone does get the proper anesthesia for it, aka local anesthetic, into that part of the cervix where we have to kind of grasp to pull towards us, once that anesthetic is there, that part should be painless. And then that sample is sent over to the pathology doctors, and then hopefully within a week or so, you get an answer on whether or not there is any concern. And I would say a vast majority of the time after we do this procedure, it's normal. There's no hyperplasia, there's no cancerous lesions. We always want to check if there's enough risk factors. So all in all, that procedure should be less than 1 or 2 minutes. The biopsy, the painful part itself, should be hopefully less than 5 to 10 seconds. All right, let's talk about the best ways to control pain during and after the procedure. All right, stick with me here, but number 1 would be to take ibuprofen, maybe 400 to 600 milligrams, maybe 800 milligrams, depends on each patient. That will help with mostly the cramping afterwards. That's not gonna make a significant difference for the actual procedure itself. We'll talk about how to make that better in a second, but that ibuprofen does help with that pain and cramping afterwards. Some people out there may talk about topicals, anesthetics, which you could either spray or rub on the cervix or the vagina. I think the vaginal anesthetic can be useful if someone has a really difficult time with vaginal exams, but the topical anesthetic to the cervix is really not going to do anything at all. What's going to really prevent the pain with the procedure is to inject a medication like lidocaine or bupivacaine into the cervix to get at least a majority of that area numbed. This injection into the cervix often does feel like a dull pinch to a lot of patients, and with that lidocaine, often with epinephrine going into the cervix, it sometimes does get into those little capillaries, and people feel some effects from that. And so if somebody is getting that lidocaine injection with an epinephrine, they might feel a little bit of a heavy chest, a fluttery heart. They might have a metallic taste in their mouth, maybe even hear a little ringing in the ears. But that injection itself takes 20, maybe 30 seconds at the most, and then those symptoms, usually taking some deep breaths, resting, relaxing, usually resolves itself within, again, 20 to 30 seconds. Now, hopefully someone gets significant reduction in the pain with this injection of local anesthetic into their cervix. A lot of times it doesn't completely numb the upper part of the cervix, so they still expect a cramp, but hopefully it does make it a bit better. Does everyone need the anesthetic is the next question, and I would say no. There are often people, usually those people are who've had pregnancies before, specifically vaginal deliveries, they're premenopausal. Usually these factors make it so that this procedure is relatively painless. For patients with that history where they've had vaginal deliveries before and the exams and pap smears and things like that generally don't bother them too much, sometimes doing that injection and potential side effects of the ringing in the ears, the fast beating heart, heaviness in the chest, sometimes they might perceive that as worse than just doing the biopsy procedure with those mild to moderate cramps for 5 to 10 seconds. And so that's a wonderful thing. We talk to patients, we figure out what the best thing is for them, and I'm always happy to do one way or the other, or even go to the operating room for more of a general anesthetic if that patient desires it. All right, what to expect after the procedure? Now, generally someone will have a little bit of irregular spotting. I wouldn't usually expect this to provoke any heavy bleeding though. We are often doing this for patients that are having heavier bleeding episodes, so sometimes it can provoke a little bit of bleeding, but the procedure itself usually would not cause any heavy bleeding. The pain afterwards, the majority of the pain is right during the procedure, but then we see it taper down pretty quickly afterwards to more of a mild cramp, maybe for a few days. Again, it can be very different for each individual. Theoretically, there can be risk of infection. However, I've never seen it with any of my patients. patients, but if someone's having foul discharge, fevers, increased pain in those days afterwards, you definitely want to let your doctor know or go to the emergency room. And a common question is, when can somebody be sexually active again? I wouldn't be within that first 24 to 48 hours. Not that it would cause any issues, but likely someone is going to feel quite crampy, and that would further irritate that area. And so I would wait at least 48 hours, and then it shouldn't be an issue. Another question, can somebody get an anxiety medication before? Of course, talk to your doctor beforehand. We should be more than willing to give someone, if they need a lorazepam medication or something like that, to help just the procedure, the peri-procedure anxiety that can happen. That can certainly help. You just need someone there with you to help give you a ride, and you might actually need to talk to your doctor about this beforehand so you can sign consents before you take the medication. I hope this video helps clearing up a lot of the mystery surrounding these endometrial biopsy procedures. We do it for a reason, and that is to rule out precancerous or cancerous changes of the uterus. And so I'm hoping this decreases some of the anxiety surrounding the procedure so that more people hopefully also are informed and also get the anesthesia they deserve for the procedure. Once again, this video is part of the 30 videos in 30 days. We're more than halfway through the month already. And please, if you can, donate to the link below. It'll help gynecologic cancer research for the month of September because it's Gynecologic Cancer Awareness Month. We'll see you tomorrow, everybody. Have a great day. First time I've shot in my living room, welcome.